Effects of liposomal bupivacaine and opioid use reduction. This figure shows the steady increase in drug overdose deaths involving opioids from 1999 to 2018. As you can see, in 1999, the drug overdose deaths involving opioids was a little under 20,000 a year. As it increased throughout the years and reached its peak in 2017 at a little over 70,000, and then finally was able to get lower due to the awareness and people starting to really implement programs to stop this. This infographic shows the opioid epidemic numbers stated in 2019. As you can see, there were almost 11.5 million people who were reported to be misusing prescription opioids. Out of those 11.4 million, 2 million of those had mistreated prescription opioids for the very first time. This is the basis of my research. Doctors all over are trying to find new ways to manage pain after surgical procedures, and liposomal bupivacaine is a very forefront effort to stop this crisis. Liposomal bupivacaine was developed in response to the opioid crisis to reduce patient exposure to prescribed opioids. The purpose of liposomal bupivacaine, commonly known as Exparel, is to reduce post-surgical pain. Roughly 95% of bupivacaine is protein-bound, allowing for a long half-life. Liposomes are used to extend the already long half-life to an extremely long half-life by providing a sustained release over multiple days. Liposomes are microscopic structures that consist of a phospholipid bilayer encasing an aqueous core. Multivesicular liposomes contain non-concentric lipid bilayers, which allows for a pattern of drug release that is more stable and has a longer duration. This chart shows the concentration of liposomal bupivacaine in the plasma over a period of time. As you can see, the initial peak at 1 to 2 hours shows roughly 150 nanograms per milliliter of concentration in the plasma. At about 40 hours, you can see that the Exparel continued to grow in the blood and get more concentrated and peak at 24 to 48 hours at roughly 275 nanograms per milliliter of concentration in the plasma. While the peak is at roughly 24 to 48 hours, you can see that there is liposomal bupivacaine located and detected in the blood up until 96 hours. And even at 96 hours, where the graph ends, there is still roughly a 50 nanogram per milliliter concentration. And liposomal bupivacaine has been seen in the blood up until 120 hours after the infiltration at surgery time. And this was not related to the effectiveness of the infiltration. This chart shows the difference between number of tablets consumption and between liposomal bupivacaine and just bupivacaine without the liposomal protein bound. On day 1, the 45 patients were both asked the number of tablets they were taking, tablets being opioid prescriptions, and on an average, those patients receiving liposomal bupivacaine had been taking 2 tablets less. On day 2, that pattern continued, and so on, up until day 5, where they were relatively off the medication, and those receiving just bupivacaine were still taking 2 to 3 a day. This chart, as shown in my report, shows multiple different procedures done using liposomal bupivacaine, liposomal hydrochloride, and a control group. This study showed that out of all the studies, only 2 favored liposomal bupivacaine hydrochloride, and the rest favored liposomal bupivacaine. Out of both of these studies, neither patients reported pain as unbearable, whereas in the control group without the postoperative pain medication, there were reports of unbearable pain. Of these methods, liposomal bupivacaine is favored over the rest of the methods to control postoperative pain. Pediatric trials have been conducted and it was ruled safe for children and allowed for a significant decrease in opioid consumption and shorter hospital stays. In a study with 60 patients, 30 being female and 30 being male, they were divided into treatment group and a control group, where the treatment group was administered liposomal bupivacaine and the control did not. The results showed that the patients in the treatment group were discharged at an average of 2 days earlier and had a delay in requiring prescription opioids for pain management, which ultimately resulted in a decreased usage. The opioid crisis in America is something that has been being dealt with for a very long time, but up until recently it has finally been seeing a decrease in deaths in opioid use and overdose. Liposomal bupivacaine is one of the many methods that have been developed to fight this horrible crisis. While the anesthetic was originally utilized in many simpler procedures such as dental procedures, many fields of medicine have quickly been adapting to it due to its obvious success in managing pain after surgery and reducing the need to prescribe opioids to patients.